Hi everyone, I'm Dr. Khudbuddin Ali, your eye doctor. So today, as part of the healthcare topics discussion, I would like to discuss a few basic things about an entity called diabetic retinopathy. So as the name itself suggests, it is a damage to the retina because of diabetes, and more specifically uncontrolled diabetes or diabetes which is not managed properly. So the major thing is because of the unhealthy lifestyle, because of the genetic reasons, because of multiple factors, because of metabolic, because it is a metabolic disorder, because of multiple factors, the burden of diabetes is rampant almost. Because being a consultant in retina, managing retina diseases, I see majority of the patients who are diabetic. But even in general practice, even in majority of the departments, most of the patients, around 20 to 30%, if I see the burden of the disease, they are either known diabetic, or there might be even many patients who do not know that they are diabetic. So these are even more complicated cases that we have to deal. So one thing is, what are the risk factors for diabetic retinopathy? So one thing is, the major thing is uncontrolled diabetes, and type 2 diabetes, a history of more than 5 years of diabetic history, whether managed or not, they have the chances that they might have changes in the retina which might be termed as diabetic retinopathy of varied grade. The second thing is, in patients with the type 1 juvenile diabetes, because the diabetes is detected early and they are under the control of medicine, insulin, so we don't generally see much changes in them, but still it is mandatory that as they attain puberty, every year they have to undergo checkup. And second thing is, there are other factors which add on to the fuel to the fire. That is, like, if they are having any family history of cardiac disease, if they are having a family history of obesity running in families, unhealthy lifestyle, sedentary lifestyle, all these factors add on. So whenever we see a patient with diabetes, it is mandatory that we have to do a dilated fundus examination. We have to check their retina in total, and after that, if we do find any changes which we term as diabetic retinopathy, we have to undergo a few investigations to make sure how severe is it, the disease. The third important factor is, there might be some changes in the retina, diabetic retinopathy, where the severity might be masked by other factors, like having severe anemia, which is common in developing countries like India, and malnourished people it happens. If the renal function is also less, so it's not proper, it also adds on to the burden. So how do we have to control this one? So first thing is, whenever a patient is detected with diabetes, so the physician generally refers to an ophthalmologist to have a diabetic fundus examination. Even if they, what you call, maybe because of some reasons they fail to refer it to a ophthalmologist, especially a retina consultant, then it is also the right, and especially, say for example, duty of the patient to get a proper retina evaluation done at the earliest. And second thing is, the problem with diabetic retinopathy is most of the changes are irreversible. That is, whatever the damage that has happened to the retina because of diabetic factors, it is irreversible, they cannot get back to normal. But whatever the quality of retina is, still healthy retina is remaining, that you have to preserve. So it is very imperative that you make sure that whatever damage that has happened cannot be regained, but whatever the healthy retina is left, you have to make sure that it retains. Third thing is, there are some medicines as part of the diabetic medication, like pioglitazones, they also add up because of their side effect causing diabetic macular edema. So patients, we are advising all the physicians to make sure not to advise pioglitazones. In place of that, whichever substitute is available to make them having a healthy diabetic control, then they can prescribe. The third thing is, so once they are detected with diabetic retinopathy, what has to be done? There are some changes of the diabetes which can be controlled with medication from the ophthalmologist. There are some things which need procedures like laser procedures, that is to prevent future attacks of blood clots in the retina as such. The third thing is, if there is some change called diabetic macular edema, so swelling in the retina of the eye because of diabetes, then you need an intravitreal injections. These are safe medicines that make sure that your diabetic macular edema comes to normal. Depending upon the requirement, you may need one or even more of these injections. The fourth important thing is, so what I have to say, there are factors like HbA1c, which are the glycosylated hemoglobin. So this is one factor that gives a broad perspective of how your diabetic control is. Generally, when we ask the patient, they say that their sugar levels are 150, 170 something. They don't even mention fasting or postprandial, but they have a values which are indicative that they have this so and so control. That is what you call tip of the iceberg. We don't know actual burden of the disease. So a better idea can be only available with HbA1c values. The second thing is, as I was mentioning, in anemic cases, in severe anemia, the HbA1c values may not be proper. That is, they might show false lower values. So if it is severe anemia and the values are something X HbA1c, but the actual values might be even double. So it is an important task that a comprehensive management, not just the eye doctor, not just the physician, they have to work in conjunction, and other hormonal disorders have to be kept into control. And there are some changes like severe damage of the retina because of diabetes, then they might need surgical correction. But it is always advisable that patients have to make sure that they control their diabetes, they follow the advice of the doctor to make sure that there is no requirement to go for a surgery. To make sure, if it is needed, that is the last step that we have to go, but as much as possible make sure and follow healthy lifestyle which develops, and make sure that you have a regular eye checkup. I hope this video is useful, and thank you. Let's work on it.